So Kenny, why don't you kick us off by introducing yourself?
Hey, I'm Kenny Schiff. I'm the founder of CareSight. Ray and I and the Lone Star organization know each other since 1993. And I'm happy to say that I visited Lone Star in Grand Prairie in 1993, and it was a very different company back then. And the reason I visited and got to know Ray is that I used to work for Rollins, and I worked for Rollins for 7.5 years. And I was part of the sales and marketing organization, but Rollins stimulated the inner geek in me. And I've taken that and gone off and running.
So Ray, let me go to you. Why CareSight for Lone Star, and why now? Why is the timing so good for it?
Lone Star has gone down a path in the last few years of trying to help the caregivers make the hospital a better place for patients and a better place for caregivers specifically. And we've done a pretty good job of that, of tracking it using the existing systems, the nurse call system specifically, and the RTLS, and being able to track that. But what we haven't been able to do is really nail that information down to the nth degree, which we really need if we're going to truly make this a improvement that can be carried throughout the hospital and show the hospital how we can do it, and prove to them that we can do it and improve the process.
So to summarize, it's really about being able to add more value to the hospital around the things that are most important to them.
Exactly.
Fantastic. So Kenny, what drove you to start CareSight in the first place?
Well, when it came down to it, I felt that there was much too much import put on the technology itself and not the value that the technology delivers. And I knew that if we had the data to support it, especially, that we could line up with the customer's initiatives, what was important to them, and we could connect the dots for them. We have a push today to get to 50 sites. When we have those 50 done, we're going to have more nurse call data in one place than anybody ever has had ever. And that's going to give us the ability to teach the customers about their peers, the things that they can learn from others.
Yeah, and it's perfectly aligned, or it will enhance what we have been aiming for the last couple of years, and that is to make the patients stay better, to improve the processes for the nurses, and to make their day easier and give them more time to spend with their patients. And that's exactly what they want to do.